When I first discovered spinal decompression, I was working with the inventor of the original Spinal Decompression Machine, Dr. Dyer. He's from the US. And I met him and we talked about this condition, and I was very skeptical. I said, I'm not sure that mechanically we can create a solution or fix a problem that has been traditionally only being able to be addressed by drugs and surgery and injections. And he convinced me to try the treatment. So I actually injured my back and I ended up going through the treatment myself. And I realized that after several sessions, my pain was gone. I was back to moving and doing my normal activities. And I said, maybe he has something here. So I purchased a decompression machine for him, and I started seeing a few patients. And then people started getting better, and then it was a few more patients, and then I had a second table. And then all of a sudden we had 5 tables, and we had patients calling with a waiting list to get in to get the treatment done because the treatment was so effective. Once I realized that, I said, okay, I'm going to change the focus of the way I practice and specialize in spinal decompression. And that's what I did. So since the early 80s, I've been doing the treatment, actually longer than anybody in the country. And we've treated thousands and thousands and thousands of patients. I've seen miracles. I've seen patients come in who went to surgeons who told them there's no hope. You'll never walk again. You'll never get out of bed again. We have to do surgery. You'll never live a life that's normal again. And time after time after time, we got these people better and got them back to their normal activities of daily living. One of the things that I stress with our patients is once the treatment is completed and the pain is resolved and the condition is resolved, it's very important to continue to move. Sometimes people are afraid that this condition is going to come back. So once they're feeling better, they become very sedentary. They don't want to do too much activity. They don't want to lift. They don't want to walk. And it's just the opposite. Once you're able to move, we encourage people to move. We want you to get back to normal. So we don't want you to leave here feeling better but not having the life that you had. We had patients, professional golfers, professional baseball players, professional football players who literally couldn't get out of bed, who went back and continued those sports and the lifting and the heavy mechanics, working on automobiles and lifting heavy tires. The idea is to fix the problem and get you back to normal. So it's very important once the treatment is completed that people move, because we understand now that the way the spine stays healthy is through movement. Every time you're moving, whatever joint it is, whatever time you're moving, you're getting fluid in the joint and keeping the joint from drying out. When that joint dries out, that's when we have degenerative diseases, we have arthritis. They're the conditions that result when the joints begin to dehydrate. So again, very important, even if you don't have a problem, it's very important to keep moving. It's very important to keep hydrated. Should be drinking water constantly throughout the day. The more water that you have in your system, the more water we can get into the joints and keep them moving. Even our older patients, we tell them if you can't do much, even if you're sitting watching television, whatever you're doing, just move. Every time you're doing movement, you're getting fluid into the joints, keeping them from drying out and avoiding the chronic conditions that will cause you pain.